Hi everyone, thanks for coming. I really want to talk about the booster doses today. At the moment across Goulburn Valley Health's local public health unit, the uptake of people who are eligible for their booster dose is only 17%. And at the moment, everybody who's had their second dose, there's a 5-month interval between their second dose and becoming eligible for their booster dose, and 17% of people have only taken up that opportunity, which is not enough. We know that the best protection against contracting COVID-19, and particularly with the emerging evidence and the increasing case numbers at the moment and what's expected in relation to Omicron, is that the best protection people can have in relation to not contracting COVID and indeed the Omicron variant is to have their third dose, their booster dose. So for everybody the vast majority of people who haven't done that, you need to come forward and get that vaccination as quickly as possible. At the moment, we're only a week away, or just 8 days away from Christmas Day. I'd really encourage people to think about this booster dose as their Christmas present to themselves, to their loved ones and to the broader community, because in the coming week and 2 weeks beyond that, across the Christmas and New Year period, people are going to be mingling. There's going to be a lot more visits in households and a lot more parties and celebrations, and we're seeing just how contagious and infectious that the Omicron variant is in terms of how quickly it's moving and spreading between people at larger gatherings. So if you haven't already got your booster dose, please make an appointment to come forward and get that. The GV Health vaccination hub at the Macintosh Centre and also at our other spoke sites around the region are taking both walk-in appointments and also appointments by phone or on the coronavirus.vic.gov.au website. So please, I'm encouraging everyone, with a week to go before Christmas, get that sleeve up again and get that booster dose, because it's going to give you the best chance of protecting yourself and the broader community. Otherwise, in terms of case numbers, we haven't talked about case numbers for a little while in our region. There's across the local public health unit, there's 232 active cases across those areas. So that's as far down as Kilmore across to Benalla and Yea, and through Benalla up to Cobram and Yarrawonga, those areas. So there's still a significant number of people in our area that have COVID-19. And in the Shepparton and Mooroopna area, there's 85 people at the moment who have COVID-19. I guess in the sense that we haven't talked about case numbers for a little while is, it's part of COVID becoming generally more part of our lives, I guess, from a day-to-day basis. But as I said before, your best defence is to get vaccinated. But we are still seeing a number of people that are requiring hospital care. And at the moment, there's 9 people admitted with COVID-19 at GV Health, and there's another additional person, so 10 in total. But one of those people is in ICU and on a ventilator. So people are still becoming quite unwell if they do contract COVID. So again, if you're in that 83%, beg your pardon, if you're in that 83% of people who haven't yet got that booster dose, come and get it done straight away. And the best place to find out where you can get it is on the GV Health Facebook page, where we're posting all of those availability for the vaccination clinic.
Have there been any more deaths in Shepparton? I know there was one from somebody who lived in Albury a week or so ago. Have there been any others in the last sort of month or so?
In early December, we did unfortunately have someone die related to a COVID illness, but not in the last, say, 7 days or so. That was on or around the 3rd of December.
And in terms of, only 17% of people who are eligible having come forward, do you know roughly how many people are eligible? Is it sort of 1,000, 5,000, just that rough number?
Yeah, it's a bit hard to determine, because when some people became eligible earlier on, in terms of they might have had a chronic disease or they might have been a healthcare worker, and that's perhaps distorting that really accurate number. But overall, that's the number we know, that there's 83% of people who are eligible haven't come forward, and that's what we want, that large group. And people will know, I mean, everybody knows with your vaccine certificate when you had received your second dose. So if you're 5 months past that dose, your second dose, come forward and get your booster dose. And even look, if people who might be at 4.5 months at the moment and they clock up the 5 months between Christmas and New Year, we're not going to worry about that. We want people to come forward. If you're in that window of say 4.5 months or longer, come forward and get that booster dose straight away and don't put it off. Get it done before Christmas.
Yeah, and obviously Omicron's turned up in Victoria. I assume there's no cases that we know of in GV yet.
Not locally with Omicron, but as we've seen, so two things in relation to that I think is really important is that it didn't take long when the Delta variant occurred for it to start to push out into the regional areas, and that was certainly the case with Shepparton and Mooroopna and any other regional community in Victoria. I think it's going to be actually quicker in terms of how fast Omicron will move, simply because what we're seeing around other parts of the country and internationally about how quickly the Omicron variant spreads and how infectious it is. So again, it just comes back to the best way to protect yourself and your loved ones against that is to get your booster dose.
I know you're expecting a spike of cases kind of over that Christmas period and beyond. Do you think that Omicron could force that to be even higher than what was expected?
Probably. So I think in the next early parts of January we'll see an increase in case numbers. That's true, but I think the larger number of cases are likely to be towards the end of January and into February, and then like what we've seen in previous outbreaks, it'll probably extend into March, I suspect, in terms of those high case numbers.
The federal government has said that it's 5 months between doses, and you're saying it's now 4.5 months you're going to be allowed. So you say that's the advice you're giving now?
So that number's under constant review. And so originally it was 6 months, you might recall. It's come down to 5 months. There's some commentary in relation to it might be shorter than that in terms of 4 months. My comments a few minutes ago were really around that if someone's at 4 months and 3 weeks, the middle of next week, and then they're going to hit 5 months between Christmas and New Year, when it's going to be a little bit more difficult just because of the time of the year for people to get access to a vaccination clinic, we're not going to be fussy about that. If they're within that window of a few days short of 5 months, we just want people to come forward and get vaccinated, and we're prepared to accommodate that type of situation.
Yeah. Have you had advice in terms of vaccine efficacy against Omicron?
So the Pfizer vaccine is the one that's being used for the booster dose, and that's the one that is, I understand, has got the best coverage and protection against the Omicron variant. So all of the booster doses, as I understand, are with Pfizer. Even if you've received AstraZeneca or Moderna prior to that, you will be receiving Pfizer as the booster dose.
In terms of someone double dosed with AstraZeneca, for example, how effective is that vaccine against?
I've only seen what's been reported in the media, that there might be some emerging concerns in relation to that, but again, in relation to AstraZeneca that is, but I haven't seen anything formal or official. It's just what's out in the public domain. But what I would say is, as I said a minute ago, the booster dose is with Pfizer. So if you've had AstraZeneca and you're due for your booster, come and get it, and you'll get Pfizer.
Do you have the resources to be able to support everyone coming out to get their booster shots now, the other 87% people?
Yes, we're coping okay, and it's not just the GV Health run services from a vaccination point of view across our region. People can access booster doses at different general practice clinics, community pharmacies, and the state-based hubs. So from my point of view, I don't really mind where people get their vaccine or their booster dose. We just want people to get their booster dose, and it's the best thing they can do by way of an early Christmas present.
Are you expecting a busy few weeks at testing centres? I know a lot of people travelling about will need to get tested. Are you kind of preparing for that as well?
Yes, we've got, so the respiratory clinic here at Graham Street will be open every day. We naturally do think there will be a bit of a dip, and people will go away for holidays, so there will be a decline, but we will still have access at the respiratory clinic every day. The drive-through site at the Shepparton Showgrounds will be closed periodically. The best place that people can access that is on our Facebook page, the GV Health Facebook page. But I'm confident we've got enough planning and staff in place over the Christmas New Year period to be able to meet any demand, subject to a big outbreak occurring, which would mean we'd have to reset as we've done in the past. But based on where things stand at the moment, access should be fine to testing.
Will the Macintosh Centre close at all, like Christmas Day, New Year's Day, etc.?
Christmas Day, yeah, the Macintosh Centre will be closed at this stage. We may reassess it, but at this stage between Christmas and New Year, the vaccinations. But and that's why we're really encouraging people to come forward for the rest of today and in the 5 working days of next week. So at this stage, that's what we're planning to do. But if things change, we can reassess that as we need to.
Yeah. Awesome. Thank you.
Wonderful.
Good.
Thanks, Matt.
Thanks.